Hi, I'm David from LifeRx Wellness, and there's a lot of issues dealing with the lower back pain and lower back problems, and there's a lot of misunderstandings about it, and some people think it's a very simple thing. You just work on the low back itself. And I want to say that we're in 2023, and there's so much knowledge that we have acquired in the last 30 and 40 years for the sports athletes that are in hockey, baseball, football, and all the treatment program that is used for the professional athletes. So when dealing with the low back, we here at LifeRx, we have an assessment program that we can figure out, looking at your whole body, where there are weaknesses, where there are tightness in your body, all related to your lower back. So the lower back is related to there's connections to your feet, ankles, calves, your quads, your hamstrings, your hips, and your lower back, and some of your middle back. So the assessment program that we figured out, or actually Jay figured out, is in this booklet here, and it's very thorough. And I can figure out through this testing program where it is that you have a weakness, what's tight, what's limited range of motion. So the therapy that is used for it begins in your ankle, and I know it's different, it's far away from the lower back, but if your calves are very tight, then you're not going to have this motion, and so your lower back is going to take a lot of strain. There's going to be a lot more work for your lower back and for your glutes if they're not working. So there are three things that could happen with your muscles in general. Muscles can be tight. Now, if a muscle is tight, it also is weak, because tightness means that the muscle is shortened, and that means that there's less contraction. So there's a weakness to it. Now, if this is weak, it's going to make your glutes work harder, and other muscles are going to have to compensate for that. So the treatment working in here to get this ankle mobility in here is very thorough. And it's working on all the calf muscles, all the top muscles here of the calf, and getting mobility in here. So this is all nice and balanced. And of course, it's on both sides. Then there's the quads. And the quads you're not doing deep work into the quads, but you're looking at where things are stuck. So sometimes muscles will get tight, they get weak, and then they get also stuck. So when your quads are stuck, there's a treatment to get mobility in it without doing aggressive work into your quads. And this also applies to the back of the thigh, your hamstrings. So there are different ways of working the quad in here, and I'll show you right here. You're going in here, there's this angle of the quad, you've got the middle and the top and the side, and then you've also got the hip, and through this, when you're face up, you can do the hips also and figure out what connections are tightening up this entire line. Then I work underneath the body, and I put my hands underneath your back, and I can find out where all the tightness is in your paraspinals, all up into here. So now I'm going to put you on your side here. Okay, so turn on your left side here. I'm going to put this here. Good. And I'm going to take this pillow. I'm going to put it between your knees here. And it's through this way that you can figure out through the hips. You've got, when someone's side lying, you have access to the glute medius, the glute minimus, maximus, piriformis, all the muscles of the glute. And sometimes these muscles are jammed and they're not moving. Yes, they're going to be weak also. And we have every morning at 7:30, we've got a workout class with bands. It's a rehabilitation program that uses short bands and long bands. It's live. LifeRx Wellness on YouTube, and this program is the best I've ever done. I've done it for 3 months, and I don't have any aches or pains or anything, and it strengthens and stabilizes your entire body, uses breathing techniques and all of that too. So that's for the strengthening part. But on the side lying, when you're side lying, you can work on all of these muscles that are falling in a really easily accessible way, and you can find where all the pain is, and by working in all the muscles while the person's side lying. All the paraspinals, you can figure out the hips, the IT band, you can warm up the quads and the hamstrings through this way, and you can really loosen this entire side. So when you're face up, you've got that whole, all those angles. Then you have them side lying. And now I'm going to put you face down. And so we're working with all of the angles for the low back, because you're three-dimensional. And that's the thing that most therapists forget, is that there's a length to a muscle, there's a width and a height. And so by working on your body when you're face up and on the side and face down, you can get all the angles. So now I can get a different angle on your calves and the Achilles tendon. And you can go right into the hamstrings, and you can figure out all the areas where the pressure is putting right on the lumbar vertebrae. You can work on the glutes this way. You can get the middle back, and you've got all these angles and all of these little nooks and crannies. And when you combine all of the work on the Achilles tendon, the ankle, on the calf, you've got the hamstrings, you've got the glutes, and you've got the lower back. You've got a full picture, and you can really take the pressure off of the lower back, and it's absolutely amazing.